Welcome to LollieTasking. I invite you to join me and other amazing and inspiring women discussing our passion, work, discovering our purpose, interesting topics, and how we seem to have it all together. I hope we can motivate you and show you you can do it too, with some planning, a little bit of balance, and a dash of determination. This is LollieTasking. Hello, LollieTaskers. I am your host, Dr. Lola, and I am very excited to have in this monthly series, Afropolitan Health, on LollieTasking. On this episode, as you all know, we dedicate the entirety of the show to a health topic in the spirit of renewing our body. My hope is by the end of the show, we would have educated you, empowered you, and motivated you to take action on your health. Today is a very special one, actually. I am dedicating the entirety of today to COVID-19 and the effects it has on children, mainly because I've had a lot of mothers reach out to me asking if COVID is affecting their children in certain ways, and also what to do now that school is quote unquote out. Another thing I wanted to mention today is that I had actually discussed with the tribe at the beginning of the year that we were going to be taking summer vacations and winter vacations in the spirit of balance. So this is actually our last show before we go on our 2-month hiatus. However, we're not gone. You can connect with us via Instagram, where I plan on actually starting something called On My Way In, where I give little tips about productivity on my way into work. And I will also be putting some information on our Facebook group. So if you've liked what you've heard so far, I would really encourage you to continue joining us in our Facebook group and also connecting with us on Instagram. I will definitely put the links in the show notes. Okay. So back to our show today. So when I had all these parents reach out to me, I thought it would be a good idea to just talk about some of the questions they had. So I reached out to my friends and family and asked them, what are the questions you have about COVID-19 and children? And to be honest, I thought they were actually going to talk about more medical questions, but a lot of questions I had actually had nothing to do with COVID-19 as a disease process. It was more coping with it and how to kind of like balance the year. So this is going to be a very short episode. However, I think it's one that is needed to discuss. And if you do have any question, please send me a direct message. I could always reply you. I try to respond to all the questions. I may not respond when you want it, but I will definitely respond at a time that works. Okay, so I'm just gonna go through the questions. Number one. And I'm not going to name names because some people wanted names. Some people gave me their names and some people didn't. So I'm just going to leave it without names. Number one, are children now more affected? I keep hearing in the news about children being affected by COVID. So I am going to say, based on the available evidence that we have, children are still not more affected than adults are. When I mean affected, both children and adults can get COVID equally, but as far as like having symptomatic evidence of COVID, we see more in adults. We also see the more severe cases in adults than we do in children. I'll talk about the inflammatory disease because someone asked that question later that's now associated with children. But even in that case, there's still really, really a small percentage of children who have it or who have had COVID end up having that disease. So question 2. What are some symptoms of COVID in children and how can I know when to go to the doctor? And also, how is it different from this new Kawasaki-like illness? Okay, so this is a loaded question, so I might go actually deep into it. So COVID-19, the reason why it's just so hard for people to know is that it appears differently on everybody. We still don't know why this is the case, but for some people, they literally don't even know they have it. And some people, they have like a mild illness, like a runny nose. And some people have like flu-like illness like fever, cough, and difficulty breathing. And some people actually end up in the ICU and need both ventilatory support, that's like having a tube to help you breathe, and ECMO support, which is basically helping you pump blood to your body. Most people who have gotten COVID, however, I would say do not get sick. It's only a small majority. As of the time of this recording of this podcast, almost 100,000 people have died from COVID. While this is horrible and we need to do things to prevent it, to prevent people from dying, in the grand scheme of things, it's still a lesser proportion of people dying compared to the people who actually have the disease. So with that being said, as far as the people tested, millions have gotten the disease and 100,000 have died from the disease. While it's still horrible, and I actually know people who are connected via from in-laws and family who have actually passed away from this disease. So I don't take it lightly at all, but I'm just kind of putting it in a grand scheme of things. That also is not to say that you should not take proper precautions and wear your mask all the time when you're out, especially when you're out. Okay. So cases of multi-system inflammatory syndrome is what it's called in children associated with COVID is basically a post-inflammatory syndrome that happens after kids have had COVID. Most of the kids that have this multi-system inflammatory syndrome don't actually have COVID at that time, but when they test their antibodies are kind of like the memory markers in your body to tell your body, like, I've had this infection before. When they test those memory markers, those children have had that infection in the past. Also, those children also have at least one family members that they know, that family know has had confirmed COVID case in the past as well. So, unlike actual COVID, post multi-system inflammatory syndrome, I'm just going to say PMIS, is not contagious. Like I said, it is post-infectious, so they've had it in the past, and now their body is having a kind of like delayed inflammatory response to it. The reason why they were saying it's like Kawasaki or is a Kawasaki-like syndrome is that Kawasaki is a similar type of inflammatory process that kind of affects the whole body. The reason why this COVID-associated inflammatory syndrome is even a little bit more difficult than Kawasaki is, it also looks like another syndrome called toxic shock syndrome. And toxic shock syndrome is actually caused by a bacteria. COVID is caused by a virus. Toxic shock syndrome, they use antibiotics to treat it. They're in the ICU as well. With COVID, antibiotics would not work. Antibiotics only works on bacterial illnesses. That's why when you have a runny nose and you go to your doctor, they don't give you antibacterial for your runny nose because it just would not work for it. Okay. I don't know if I answered the question. Oh, the symptoms. So symptoms that you can see. So there are multiple symptoms you can see, and I always suggest you talk to your pediatrician and let them triage it, because a lot of times, for example, with Kawasaki, it's usually seen in kids younger than 5, and they have at least fever for 5 days. They have redness in their eyes, cracked lips, rashes all over their body, especially the trunk of their chest, their arms. So we also see that kind of symptom in this post-inflammatory syndrome that children have. Another thing that you want to look out for is changing skin color, like they may be pale, patchy, redness. I already talked about redness in the eyes and cracking lips. Swollen lymph nodes is also very common. If they start having abdominal pain, vomiting, diarrhea, like I would say just take them to the doctor, have them checked out. Some people also will have swollen hands and feet. They don't necessarily have to have all the symptoms. I would say if you're concerned and suspicious, it's never wrong to call your pediatrician and talk to them about it and see if this is what your child has. There are other syndromes and symptoms and diseases that may mimic things. So I don't want you to think if your child has a rash at all, your child has this syndrome. Okay, since you're a cardiologist, what are the cardiac manifestation of this syndrome? I heard it affects the heart. Okay, so yes, let me kind of talk about the Kawasaki first of all. So Kawasaki, like I said, leads to inflammation in the arteries of the heart. The arteries of the heart is the blood vessels that actually feeds the heart. They're called the coronary arteries. They're the first vessel that comes out of the heart before the rest of the body. So the heart gets fed first. In Kawasaki, when we know kids have Kawasaki, we give them a medicine called IVIG to help calm down the inflammation. So basically, when I say inflammation, that means like the body is kind of overreacting to something. Like the body thinks there's an infection in itself, so it's trying to calm whatever that infection is, and in doing that, it is affecting the other vessels in the body. I don't know if that makes sense. So with Kawasaki, they have that inflammation, like all their vessels become inflamed, and that's why the coronary arteries become inflamed. Kawasaki is the number one cause of acquired heart disease in children. I say acquired because a lot of heart disease in children are things that they are born with. Kawasaki, however, is one of those that can actually cause children to have what we consider like a heart attack. Usually children do not have a heart attack, and we follow them closely. Usually patients with Kawasaki don't necessarily need the ICU. They have this IVIG medication. We start them on aspirin, and we follow them outpatient. If they don't, a lot of times over time it calms down, and there's some children that have there's some people that have this post-Kawasaki inflammation of the coronary vessel, and those kids we follow long term. Okay, so as far as with post multi, I should just say PMIS, yeah. So as far as PMIS, uh, the reason why it's concerning is that there are some kids that they get so sick and their blood pressure is low and they have to be in the ICU. And one thing we have noticed from a heart standpoint, kids that have PMIS is that not only we don't really actually see a lot of that coronary vessel inflammation, but we see a lot more of the actual tissue of the heart being sick. We call it a form of cardiomyopathy. Cardiomyopathy is like when the actual heart muscle is sick. But the good news is that they have noticed that most of these kids, when they recover, the heart muscle starts to feel better. And some of these kids have been in the ICU, even some have needed chest compression, have now gone home. And they're obviously it's a new disease and we're still following it. But there's been some reassuring things out there that those heart muscles starts to recover function. Obviously, we start them on medication and they continue to take that medication to help with remodeling of the heart cells. Let me see. What is the best thing I can do to protect my child? Okay, this is very important. So I said that the best thing you can do to protect your child is continue to maintain social distance now. I know it's annoying. I know it's been a long time. The kids miss their friends, but there are other ways we can get that connection back. I think it's perfectly okay for them to go play outside while they're riding their bikes. You can have fun with them in the living room. But at the same time, like keeping social distance. If they have to go outside, I do recommend that they all wear a cloth mask just in case they were to run into other kids in the neighborhood. I also do think it's very important that they go outside and get some vitamin D. You don't want them choked up in the house continuously. Okay. Let me see. When can the children go back to school? Oh Lord. So this right here is one that I'm a little worried about because I do want my children to go back to school. I want them to go back to school. Especially my youngest one, I don't think he's having the social interaction he needs to have at this age to help him. Um, but there's still no vaccine for COVID-19. And as people are starting to creep out, we've also seen like a rise in COVID-19 cases. While a lot of kids may not have the severe case and have death from it, there are a few kids who do have it, and unfortunately, we just don't know which of these kids are um, prone to getting this severe COVID or not. So I think it's just important to continue doing what we're doing, like washing our hands, using hand sanitizer, maintaining social distance, wearing face cloth covering, washing our hands often, cleaning our toys often, avoid touching our face. Just kind of teaching the kids on that. So at this time, like I really don't know. I feel like every month is different. If they come out next month and there's a vaccine, heck yeah, they should all go back to school when the fall rolls around. But we just don't know. So we're just kind of taking things as it is. And I'm not even saying taking it a month at a time, like literally taking it a day to a week at a time. Uh So, how can you help with children that may have anxiety due to COVID-19? Okay, I have actually noticed this in my own daughter because every time I go to work, she's like, Mom, are you sure you're not going to get it? When I come home, she's like, Mom, go take a shower. And I think a lot of it is out of concern and worry for her mother because she knows I am going into the hospital and some patients do have COVID in the hospital. Um, but I think it's important to continue to remind your children that, the doctors are working on it. We have scientists working on it. And we just need to give it time. And while we give it time, we just need to stay safe. We also need to give them some control of what they need to do, like teaching them to wash their hands and giving them ways they can avoid getting COVID. We also need to give them a control of their schedule. Like when you're making the schedule, make the schedule with them. Say, what do you think we should do during this time? I'm not saying give them total control, but make the schedule with them so they feel like, oh, I made the schedule. And there's a lot of research that shows that if they are involved in making the schedule, they would actually follow well, I wouldn't say they will, but they're likely to follow the schedule. Okay. Another thing you want to keep in mind is media. It is very difficult now, especially with a lot of parents working from home, to try to limit the amount of screen time the kids have. But it is very important that they limit the screen time. I always encourage them to try to create things with things they have in the house. My daughter loves to do experiments. She messes up our kitchen all the time with random experiments. And my consolation prize on it, one, she cleans up after herself. That is a must. And two, um, she's not on social media. I mean, not social media. She's definitely not on social media, but she's not on media or using screen time. She's learning to use her creativity to help herself stay stay useful and doing things that matter to her, right? She's not depending on a show to fill that void, and she's not bored. Okay. Let me see. I think I'll ask one or two more questions, and then here's okay. So, someone else asked about daily schedule, and I'm actually gonna put a link to my email list so you can actually get um my daily schedule. So if you sign up for my email list, I will go ahead and forward to you our daily schedule that we use in our house. And I've also put some links of virtual schools that the kids are going to be using this summer. So it's basically a summer daily schedule. So when creating a daily schedule, the most important thing is that you have to have a wake up time, you have to get them dressed and have breakfast done at a particular time. Kids need structure. It is not okay for them to wake up and lounge down at 10 p.m. Maybe not 10 p.m., but like noon, right? Um, it's definitely not okay. Like you have to give them structure. You also have to decide, what works for everybody. Like a schedule for a 2 year old is not going to be the same for a 10 year old. So you got to think about that. You need to think about things to do to motivate them to stay on top of the schedule. You have to have a good bedtime routine. I talked about earlier that you have to, I recommend, now you don't have to, but I do recommend that you create a schedule with your children so they feel involved and empowered and they're likely to follow the schedule. If they must go on social media, I encourage you using social media with them, or at least teaching them safe practices on how to use it. I also encourage you scheduling like regular play dates with cousins and friends. That way they can kind of stay social and stay up with their friends. I think this would be my last question and I will sign off. Okay, maybe two more. Okay, so what do you do about kids? I feel like I've noticed that. Okay, sorry. What do you think do about kids that seem to be exhibiting bad behavior during this time? Okay. Oh, child, let me tell you. Everyone is so worried and everybody is so anxious, and the kids are not exempt from it. You have to give them grace. They have been out of their normal routine and their friends for the past 2 months. You know, when they're stressed, they're not going to come tell you, oh, mommy, I'm stressed. Mommy, I'm anxious. They're going to act out, especially little kids. That's just the way they know how to act out. They just don't understand what is this going on with me. While I do say give them grace, I do not condone bad behavior. When they are having bad behavior, it is very important to redirect them. A lot of it may be a cry for attention. So there's this concept of doing a time in more often instead of a time out. So when they are exhibiting bad behavior, definitely they get a timeout. But when they are exhibiting good behavior, reward those behaviors by time in or things that they can do. I don't believe in rewarding behavior with food or candy or things like that, but rewarding it with actually time. Kids love to play with their family. They love to, just do things together. Maybe have them choose the game that you're going to do on Friday during like, Friday night game day or something like that. For younger kids, it's very important to direct their attention. Definitely reinforcing good behavior works a lot more. Positive reinforcement works a lot more than negative reinforcement. And that is the truth. Um, Okay, so this is the very, very last question, and then I'm going to sign out. So, a mom said, I feel overwhelmed with everything. I am so used to the kids being at school and all camp, and then I have respite. But now it seems like I have no respite from the kids. Oh, child. Let me tell you. So, first of all, let me just say, first of all, you are not alone. If you are stressed, it is perfectly okay to acknowledge that you are stressed. Okay. But after you are stressed, you have to take action. Okay. I would say the first thing you need to do, number one, acknowledge it. Yes, I am stressed. Two, how am I going to change it? I think a lot of times changing your perspective makes a lot of difference. People would, you can see it as, oh my gosh, I have so much things to do. And, I'm here with the kids. I can't get away from the kids. There's just so much to do. Or you could see it as, I have no hard time with my kids. Maybe this is a time to learn a new hobby. I'm not saying do it all day because you have your full-time job too, but maybe create time during your break time with the kids to work on that so you both have something you look forward to. Okay? I think a lot of being stressed also have to do with when kids are acting out, right? If you're home and you're trying to do your work and your kids are acting out, it's hard for you to concentrate at work. So you're thinking, I need you to go back to school so I can focus on my work. But as said earlier, if we focus on the positive behavior that they're doing and kind of help empower them, that might help a little bit of your anxiety and stress. Obviously, everybody is different, right? Um, so if you actually, for the LollieTasking listener, most of you know I do help high achieving women with balance, work life balance, and because of everything going on, I'm actually giving free 15 minutes consultation to help strategize any part of your life. You can send us a direct message via Instagram and just say, I listened to the podcast. I'd love for you to help me in 15 minutes. And then I'll send you a questionnaire to see if you qualify for the 15 minutes. Because obviously I'm going to have tons of people sending me messages and I only have limited time in the day to do it. So I have to narrow down who I can give this to, and I'll try to give it to the people who I think need it the most. No strings attached. But it's so real. It is so real, because I mean, even as a working mom, we have this tug of war between our work life and our home life. And now that work life is present in our home life. It's like you cannot escape from both. So I don't want you to feel bad that you feel the way that you do. But however, I do want you to take action and be intention and actually say, you know what? I am ready to balance my life. I am ready to find ways to change it. While everybody goes through this and can go through this no matter what stage in life you're in, not everybody takes action. And I tell the women I coach that people underestimate the impact of stress in our life. Stress actually kills. It's one of the leading causes of anxiety, is one of the leading causes of depression, is one of the leading causes of hypertension, is one of the leading causes of depression. It also predisposes you to addiction, especially overeating. It prevents you from losing weight because stress increases the cortisol in your body, right? Which causes central fat in your belly, that belly fat that you haven't gotten through. So unfortunately, this is stressful for everybody, right? But there's some people that are going to be able to deal with the stress better. A lot of things I also teach the women I talk to is that not only can we overcome stress, one thing we have to also do is maximize our time. A lot of stress that we have has to do with just our productivity and management skills. So what I help women do is help them manage whatever aspect of their life that they're having problems with. Okay? I think I'm going to be done with that. And in closing now today, I am going to give you some tips that so I'm going to ask myself so I'm going to do the random question that I ask my guests, okay? So the quick actionable tips I'm going to give you guys was basically, how to create a schedule, okay? So without COVID-19, as we know, summer has always been a transition time for children and for working parents. Like I said earlier, it's even more stressful to figure out plans for children, especially when there's no summer camp to go to, And if you're a virtual worker, like you're working from home, or even an essential employee, like how do you balance work life? So you got to figure it. The first step is actually creating a schedule. You have to accept the known. We are in a crisis. However, we have to continue to nourish our family's physical, mental, and spiritual growth, okay? So what I want you guys to do is think about what you want your ideal summer to look like and see if there's a virtual alternative to it, okay? Create a schedule that promotes a regular sleep, mealtime, and bedtime, so that when it's time to transition back to school, whenever that time is, the kids don't have a hard time going through that. Like I said earlier, you have to have an early routine, irrespective of if they're waking up to do nothing all day or if they're waking up to have a productive day. Be sure to incorporate your chores, electronic device time, and activities in your schedule. One thing we have done is have a summer theme. Our summer theme is traveling while not traveling. So what we are doing is taking virtual excursions to different parts of the world and learning about different parts of the world while we're at home. And if you actually put your email lists, if you send me your email, I am going to actually send you our exact schedule with the links of the virtual academies that we go to. Like I said, stay social, continue virtual play dates with cousins and friends, be flexible, be prepared to make changes, stay active, like taking walks, playing outside, incorporates dance-offs, and just have fun, okay? This too shall pass. This too shall pass. Okay. What's your favorite quote? Okay. So my favorite quote is, do not be anxious. I think this, okay, first of all, let's start over. So I think this quote is perfect for this moment in time. It's, do not be anxious about anything, but in every situation by prayer and petition with thanksgiving, present your request to God. And the peace of God, which transcends all understanding, will guard your heart and your mind. And the scripture was taken from Philippians chapter 4, verse 6 to 7. Okay, so that concludes our episode today. Again, all our information is going to be in the show notes. Please do feel free to direct message me whenever you want. Or if you want to take advantage of the free 15-minute consultation or strategization I'm going to do for you. You can either connect directly through Instagram, through Facebook via our group. You could join our mailing list. I could send you the information about the summer schedule. And like I said, on our Instagram, I'm going to have a daily information about productivity tips. I think I'm going to call it as I go in or something, as Lollie goes in, which is something I'm going to be doing as I go into work, trying to maximize my time, but at the same time staying connected with my audience and at the same time being balanced. So I would not be back on the podcast till the fall. So I hope you all have a fantastic summer holiday. Please stay safe, social distance, wear your mask, and definitely, like I said, just stay connect on Instagram. Okay. If you have any, if you need any information, just look down on the show notes. Okay. All right. With that being said, thank you for joining us for another inspiring episode of LollieTasking. We will have other information down below. If you want to be empowered by daily health tips, follow us at Afropolitan Health on Instagram. Also, don't forget to follow us on IG, where all the coolness is going to happen from now on, at LollieTasker, or join our Facebook group at LollieTasking. Till next time, remember, health is wealth. It's up to you to take charge of your health so you can achieve your full potential. Have a wonderful day and a blessed and wonderful summer ahead. See you in the fall.